Williams Syndrome by Kristen Tilling. What is Williams Syndrome? Williams Syndrome, or Williams-Bierman syndrome, is a rare neurodevelopmental genetic disorder. People with Williams syndrome often an unusual elfin appearance with a low nasal bridge. Unique traits includes high levels of sociability and very good communication skills. The high-level verbal skills may mask other developmental problems and sometimes contributes towards a late diagnosis. Many people with Williams syndrome have cardiovascular conditions, connective tissue problems, and endocrine abnormalities. This condition occurs periodically in about 1 in 10,000 to 20,000 live births. People with this condition often need ongoing care. Possible cause: Williams syndrome is caused by a missing piece on the region of chromosome 7. An individual is missing about 25 to 28 genes. One of these genes that produce the protein elastic. Elastic gives elasticity, stretchiness to the blood vessels and other body tissues. Williams syndrome can be passed to offspring in an autosomal dominant inheritance pattern, or occurs in the egg or the sperm. And it's believed to be present at the time of conception. One copy of the abnormal gene needs to be present for the syndrome to appear. The abnormal gene can be inherited from either parents, so either the mom or dad. In most cases, Williams syndrome occurs randomly with no family history of the disorder, and there is a 50% chance that could be passed down the condition to their children. Characteristics of Williams syndrome. Symptoms could be connective tissue abnormalities, low birth weight, heart defects, kidney abnormalities, high blood calcium levels. They could be sensitive to sounds. They might have low muscle tones. Teeth being unusually wide, slightly small with wide spaces than normal. Sleeping problem, heart and blood vessel problems. Facial characteristics: they will have a small upturned nose, long upper lip length, wide mouth, small chin, puffiness around the eyes, broad forehead, full lips. White lace pattern may develop around the iris. Adults may have a long face neck. Behavioral characteristics includes inattention, distractibility, overactivity, restlessness, anxiety, excessive worry, social disinhibition, over formality, interpersonality, sensitive, engaging, and charming, cognitive and development features, learning disability, cognitive challenges, spatial relations, fine motor skills, developmental delays, like it'll take longer for them to walk or to potty train, for example. Speech, social skills, and long-term memories are usually well developed. High levels of expressive language skills, keenness to communication, especially with adults. And most children are not fearful of strangers. Treatments and therapies. There is no cure for Williams syndrome and standard treatment. Each medical and developmental issue should be adjusted by a specialist. Recommended therapies are physical therapy, occupational therapy, speech therapy. They will have a restricted diet of vitamin D and calcium, or be prescribed to a corticosteroids. Affected children with heart defects may require surgical intervention to repair the defect. Additional therapy is music therapy, hippotherapy, which is horseback riding. Aquatic therapy is an exercise program that is performed in the water, and sound therapy. Finally, children with Williams syndrome typically qualify for Individualized Education Plan, or IEP. As teachers, we should work together with families, school staff, and therapists to determine individual educational and developmental goals for the child. Children with Williams syndrome learn best with consistency and structured instructional routines, clear, realistic expectations, social stories, scripts, and visual schedule, and technology. By breaking down smaller chunks of materials into manageable parts, audio and dynamic visual support, rhyme, rhythm, music, or performing, finding materials that they will have an emotional connection with and specific praise. Children with Williams syndrome benefit from one-to-one support to help their learning skills, following instructions, and making sure to make eye contact and clearly say child's name before giving instructions. These are some ways children with Williams syndrome can learn best.